I'm a dentist, a physician, and a surgeon. I trained for over a decade to learn how to operate on the patients with the most severe cases. And I'm going to tell you right now that surgery is never where I start. You yourself may have been told you need something removed, something reconstructed, or something replaced. Maybe it's a full mouth of failing teeth. Maybe it's a jaw joint that's been problematic for years. You have been bounced around and received opinions that all sound a little different. And somewhere underneath all of it, there's a question that you can't quite get a straight answer to. Do you actually need surgery? And if so, how much surgery? After treating thousands of patients and spending years training other surgeons how to do what I do, I started seeing a pattern in failed cases that were referred to me, and it almost never had to do with surgical skill. What I found instead was something that surprised me. The outcomes that fell short usually weren't because the surgery was done poorly, they were because too much was done for that specific patient. And the cost of that mistake isn't just a harder recovery, it's something that follows the patient for the rest of their life. I'm going to walk you through how I think and make treatment decisions, what I look for before I recommend a procedure, and the one thing most patients don't know to protect that changes everything about their long-term outcome. Point 1, the referral to a surgeon is not a prescription for surgery. When most people get referred to an oral surgeon, they assume the decision is already made. The referring doctor found the problem, and the surgeon is there to fix it. Patients show up already bracing themselves for a procedure date. But a surgical consultation is a diagnosis appointment. The first job is to figure out what is actually going on and what the correct next step is for that specific case. And here's what I've seen happen over and over. Patients who arrive convinced that surgery is the answer tend to stop asking questions. They're in survival mode. They just want to know what happens next and when is it going to be over. The referral isn't the answer. It's the beginning of figuring out what the answer is. And here's where it gets counterintuitive. The surgeons and patients who took time prior to surgery got better patient outcomes than the ones who rushed towards surgery. The reason isn't what you'd expect. And because of that, some patients never hear about other options, maybe the one that might have gotten them the same result or even a better result with a lot less. I see this most with patients who come to me after already having something done somewhere else. They had a consultation, they were told what was happening, they went along with it, and when I look at their case, I'm thinking, why did we go straight there? There may have been a simpler path, but nobody stopped to ask whether it existed. That's not always the surgeon's fault. Sometimes patients come in so ready for surgery that a conservative option would have felt like being dismissed. Like the surgeon wasn't taking it seriously enough. I get that. When you're in pain and scared, you want someone to do something. But here's what I've learned. The ones who slow down long enough to ask, what is the underlying diagnosis? Do I actually need this right now? Almost always end up in a better place than the ones who just wanted it over with. Not because they avoided something necessary, but because they made sure it was necessary and that they had the right surgeon before they did anything else. And at that time, by all means, go fast. Get it done as quickly as possible. Once the diagnosis and correct treatment plan is done, go fast in that direction. But first make sure you have the right procedure and the right surgeon. Which brings me to the part of this that I want every patient to understand before they make any decision about their teeth, their jaw, or their bite. There's something most surgeons don't make a priority that determines how many options you'll have 10, 20 years from now. Point 2 being, removing bone you don't have to remove is a mistake patients pay for forever. That thing is knowing when to stop, how much to do, and how much to leave alone. Whether I'm treating a jaw joint that's been painfully locking up for years or rebuilding an entire mouth in a single day, the question is always the same. What's the most conservative approach available that gets this person where they need to go? The place I see this matter most is in full arch implant surgery, because the stakes of getting it wrong are permanent. In a lot of full arch implant practices, the standard approach is to take out a significant amount of bone to make room for replacement teeth. A thicker bridge requires more clearance, so bone gets removed to create that space. Patients are told this is just part of the process, but bone isn't just there to hold your teeth, it's living tissue. It gives your face shape, it supports how you chew, it matters for your health long past the day of surgery. It gives you options for the future. When you take bone that didn't need to go, you can't put it back. And when that patient needs a revision, needs something adjusted, or wants a different option down the road, they're now working with less than what they started with. You've permanently limited what's possible for them. You can always do more later. You can never fully undo what's already done. And what most patients don't realize going in is that there's a way to rebuild an entire mouth in a single day without taking the bone that doesn't need to go. The reason more practices don't do it that way is that it requires more planning, more precision than the one-size-fits-all approach. My whole surgical philosophy comes down to this: find strong, healthy bone. Build around it. Don't take what you don't have to take. We use 3D imaging and virtual planning before the patient ever gets to the operating chair. So we know exactly where the best bone is and where each implant can go. The surgery becomes precise instead of aggressive. And the patient leaves that day with a full smile that didn't cost them more than it needed to. A big part of what I do now is training other surgeons, and every time I train someone, this is a thing I come back to. I can teach the mechanics of placing an implant in an afternoon. What's fundamentally more important than that is understanding this. Your job isn't just to fix today's problem, it's to make sure you're not creating tomorrow's problem. For the patient, keeping more bone means options stay open. If someone needs a revision 5 or 10 years from now, there's something to work with. That's not a small thing. That's the difference between a straightforward fix and a complicated situation from which the patient has to recover. So what does this actually look like when you're sitting in a consultation? There are 3 questions that will tell you very quickly how a surgeon thinks about your case and whether they're thinking about you specifically or just about getting the procedure done. So point 3 is the 3 questions that tell you everything about the surgeon you're sitting across from. Imagine this: you're in the consultation. The surgeon has looked at your scans. They've told you exactly what they think needs to happen, and it sounds reasonable. They clearly know what they're doing, and you're nodding because you don't know what else to do and you don't want to seem difficult. The surgeons I respect most spend more time talking about the patient's situation before they talk about the procedure. The ones I steer people away from do it the other way around. The order of that conversation is a signal. Here are 3 questions. The questions are: what's the most conservative option here, and what would have to be true for that to work for my situation? Question number 2, how much bone gets removed in this procedure, and does it have to be that much? And question number 3, if I need something revisited in 10 years, what am I working with? A surgeon who can answer all 3 of those directly isn't threatened by the questions. They've already thought about all of that because they were thinking about you, not just the procedure. If the questions get dismissed or the answers are vague, that's useful information too. If this is the kind of thinking you want more of, subscribe. The next video in the series goes into something I see mishandled constantly, and it directly affects whether treatment actually works or just gives you something to do while the condition persists. The link is in the description. Point 4, the patients who get the best outcomes show up differently. Most patients walk into a surgical consultation with their pain and their hope. The patients who walk out with the clearest picture of what they actually need are the ones who showed up prepared. That preparation is what shifts the conversation from the surgeon's default plan to your specific situation. Once a large surgery has been done, once bone has been removed, once the prosthetic is built around an aggressive approach, reversing course is difficult and expensive. The window to ask for something more precise is before the first cut, not after. A lot of complex cases I handle are revisions. Patients who had full arch procedures done somewhere else and came to us because something wasn't quite right. In a lot of those cases, the surgery was technically fine. The implants are in, everything functions, but the bone that was taken out, the margin that was cut wider than it needed to be, that's done. We can improve the situation, but we can't restore what's already gone. I want you to stop accepting this is just how the procedure works without asking why. It may be how it works in that practice with that approach, but it's not necessarily the only way. I want you to start asking what the plan protects, not just what it fixes. Any surgeon can tell you what they're going to do. The more useful question is what they're going to leave alone and why. Here's what that preparation actually looks like. Point 5, what do you do before you walk into the surgeon's office? The patients who get the best outcomes aren't always the ones with the least complicated cases. A lot of the time, they're just the ones who showed up prepared. They had their history written down, they knew what they wanted to protect, they asked questions instead of just listening. That changes what's possible in a single appointment. Think about going to a contractor to renovate your kitchen. If you walk in with no idea of what you want to keep, no sense of your budget, and no questions ready, you're going to get a plan built around what the contractor usually does. But if you walk in with a list of what matters to you, the whole conversation goes differently. It's the same space, but a completely different outcome. 30 minutes of preparation before a consultation can change the direction of your entire treatment. Not because you know more than the surgeon, but because you've given them the information they need to make the right call for you. Here's what to do before your next appointment. Write down every treatment you've already had and whether it helped, didn't help, or made things worse. Be specific. The surgeon needs to know that history. Write down what your situation is actually costing you day to day, not just money. What can you eat? What can't you eat? What do you avoid? What does a hard day look like? Write down your goals with your new smile. What do you envision doing when your situation is corrected? That context matters. Make sure the surgeon looks at a 3D CT scan of your case at the consultation before recommending anything. A recommendation without 3D imaging is a guess. Write down those 3 questions from the last section and bring them on paper. If you've been told you're not a candidate for something, get a second opinion from a specialist. Not a generalist, a true specialist in that field. What one person can't do and what another person with expert training can't do are 2 very different things. I became a surgeon because I wanted to help people. And the thing I've learned after thousands of cases is that helping people doesn't always mean operating on them. Sometimes it means slowing down long enough to figure out what they actually need. If you've been told your situation is out of reach or that the only path forward is something big and scary, get another opinion from someone who has seen enough cases. Because what looks impossible to one surgeon often isn't to another. The next video is specifically about jaw pain and what's actually going on when clicking, popping, or a bad bite won't go away no matter what you try. The link is in the description and it's on the end screen.